So the medical personnel that is our frontline workers that been infected, none of them are involved those working in the COVID ward and the ICU. None of them. In other words, perhaps that is most safest place, because why? All our healthcare workers they have protective equipments and etc. So they are protected. But the one that infected our healthcare facilities, mainly they attended function, for example, mosque gathering, for example, and they got contracted the virus there and bring the virus to the clinic or bring to the hospital. So this is one. Second is that the patient that comes to us do not declare or even inform us that they are related to a positive patient. And when we provide the treatment, and after the treatment being given, then only the history been revealed that they have a contact positive. And then when we test the patient positive, then we have to take care of ourselves and make sure that we are also being tested. So the infection is not mainly from the patient, but it is actually from the community, whether it's a wedding function or whether it is actually a public gathering. In the past, you look in the 2 weeks ago, we were trying to see, because tabligh group involved those gathering in surau, in the madrasah, as well as in the mosque. So they could have infected others during the gathering. Death rate, because if you look into the 15 cases that we have, the first case that we have involved a pastor. And again, some of our death rate, they have comorbidities, for example, diabetes, hypertension. Secondly, you look into our death rate, the age group. Age group, most of them are more than 70 years of age. So that's another high risk group. Age is one of the indication of a high risk group. Second is the NCDs. And third is most of the tabligh group, if I'm not mistaken, 9 of them came to us at a very late stage. As I explained, there's 5 stages. Stage 1, asymptomatic but positive. Stage 2, positive but mild symptoms. Stage 3, they have some form of pneumonia, but they do not require oxygen supplement. Stage 4, they require oxygen supplement therapy. Stage 5, they couldn't breathe well and we need to intubate them and then put on ventilator. So most of them comes either stage 3, because the last patient, for example, they already have symptoms of difficulty in breathing for the last 3 days. So he came in already about stage 3 or stage 4, need oxygenation and all. So, and then they deteriorate very fast to stage 5. So this is why one of the contribution to the fatality is because of delayed in presentation to our hospital and clinic.